नमस्कार। एनरेक्टल डिसऑर्डर इन चिल्ड्रन लेक्चर सीरीज में आपका स्वागत है। इस लेक्चर सीरीज में के लास्ट एनरेक्टल डिजीज के अंदर हम पढ़ेंगे हेमोरॉइड्स और पाइल्स इन चिल्ड्रन। द सिनोनिम्स आर rectal lump, piles, lump in the rectum, hemorrhoids or grapes of the wrath. Definition of the hemorrhoids is defined as dilated or enlarged vein in the lower portion of the rectum or anus. Hemorrhoids are vascular structures in the anal canal which help with the stool control. They become pathological or become piles when swollen or the inflamed. In their physiological state, they act as a cushion composed of arteriovenous channels and connective tissue. They may be associated with pain, bleeding, itching, and feeling as if a lump or bump is hanging down. What is the incidences of hemorrhoids? Symptomatic hemorrhoids affect more than 5 million individuals in India per year. The prevalence of hemorrhoid disease is not selective for age or sex. The prevalence of hemorrhoid disease is less in underdeveloped countries or developing countries. The typical low fiber, high fat Western diet is associated with constipation and straining and the development of the symptomatic hemorrhoids. Etiology of hemorrhoids. It is a known fact that constipation and prolonged staining at stool are main cause of piles. लंबे समय तक कब्ज का बना रहना और मल त्याग के समय हम लंबे समय तक अगर स्टेनिंग करते हैं तो यह पाइल्स या हेमरॉइड्स जनरेशन का मेन कॉज होता है, क्योंकि ब्लड सप्लाई टू द these area enhanced by giving staining at stool. Low fiber diet causing small caliber stool and staining during defecations. Sitting for prolonged period at closet. Hypertension mainly in the portal vein. Obesity, sedentary lifestyle, constipation as well as chronic diarrhea. Lack of erect posture, familial tendency, higher socioeconomic status, colon malignancy, hepatic disease, spinal cord injuries, loss of rectal muscle tone, rectal surgery, and episiotomy. Anatomy and pathophysiology of hemorrhoids. Hemorrhoidal cushions are a normal part of the anal canal. The vascular structures contained within this tissue aid in continence by preventing damage to the sphincter muscles. There are three main hemorrhoidal complexes traverse the anal canal: left lateral, right anterior, and right posterior. Engorgement and staining result in prolapse of these tissue into the anal canal. Over time, the anatomical support system of the hemorrhoidal complex weakens and exposing this tissue to the outside of the anal canal where it is susceptible to injury. Although small external cushions do exist, the standard classification of the hemorrhoidal disease is based on progression of the disease from their normal internal location to the prolapsing external position. Now the presentation. Patient commonly present to a physician for two reasons. Number one is bleeding and second is protrusion, something coming out from anal canal. Pain is less common than with fissures. If a child is complaining of bleeding and no pain, then we understood then the disease can be a hemorrhoid or the piles. Dull ache, engulfment of the hemorrhoidal tissue. Severe pain may indicate a thrombosed hemorrhoid. Hemorrhoidal bleeding is described as bright red color. seen either in the toilet or then type of hemorrhoids. There are four type of hemorrhoids. First is external hemorrhoids. It occurs outside of the anal verge, that is distal end of the anal canal. It is sometimes painful. Swelling and irritation are present. Itching is also present. Prone to thrombosis. If the vein rupture, a blood clot is formed. These are called thrombosed hemorrhoids. As seen in our picture, this is external hemorrhoids at the anal verge. Second one is the internal hemorrhoids. It occurs inside the rectums. It is never painful, may bleed when irritated. In case of the severe constipation, when the feces passed in hard form, then it bleeds. If these two external hemorrhoids and internal hemorrhoids are not treated properly, then it creates other features. In this other picture, we can see this is internal hemorrhoids, while the external hemorrhoids at the outside of the verge of the anal canal. The third type is prolapsed hemorrhoids. If the internal or external hemorrhoids are not treated properly or left untreated, then it distended and pushed down the anal canal as seen in this picture. And the fourth and the last is strangulated hemorrhoids. If anal sphincter muscles goes into the spasm and traps a prolapsed hemorrhoid outside the anal opening and supply of the blood is cut. Presentations. Occasionally patient can present with significant bleeding which may be cause of anemia. Colonic neoplasm must be ruled out. Patients who present with a protruding mass complain about the inability to maintain perineal hygiene and are often concerned about the presence of a malignancy. Then evaluation. Diagnosis of hemorrhoidal disease is made on physical examination. Inspection of the perineal region for evidence of thrombosis or excoriation is performed, followed by careful digital examination. Anoscopy is performed, paying particular attention to the no position of the hemorrhoid disease. The patient is asked to strain. If this is difficult for the patient, then maneuver can be performed while sitting on a toilet seat. The physician is notified when the tissue is prolapsed. It is important to differentiate the circumferential appearance of full thickness rectal prolapse from the radial nature of the prolapsing hemorrhoids. The stage and the location of the hemorrhoidal complexes are defined. Then staging of the internal hemorrhoids. There are four stages of internal hemorrhoids. In first cases, internal hemorrhoids that bleed. Second stage, internal hemorrhoids that cause bleeding and prolapse with the straining but return to their resting positions by themselves. In the third, internal hemorrhoids that bleed and prolapse with the straining and require manual efforts for placing into the anal canal. And the fourth, internal hemorrhoids that do not return into the anal canal. तो हम चार अवस्थाओं को इस तरीके से समझ सकते हैं. पहली अवस्था के अंदर ब्लीडिंग होगी इंटरनल हेमोराइड्स के अंदर. सेकंड स्टेज के अंदर कुछ वहां पर प्रोलैप्स होगा, लेकिन जैसे ही मल त्याग करता है पेशेंट तो वापस वे अपने पोजीशन पहुंच जाते हैं. थर्ड स्टेज के अंदर प्रोलैप्स होगा, साथ में ब्लीडिंग भी होगी और वहां पर मैनुअली जो है उसको अंदर पुश करना होगा. एंड फोर्थ स्टेज के अंदर इंटरनल हेमोराइड्स जो है वो अपने आप वापस एनल कैनाल के अंदर नहीं जाता है, बाहरी लटका रह जाता है. And now the sign and test. Rectal examination, visual as well as the digital rectal examination should be done. The test is stool, WEC या FOBT test, sigmoidoscopy, anoscopy, proctoscopy. Complication of the hemorrhoids. The blood in the enlarged vein may form clot and the tissue as surrounding the hemorrhoids can die due to the necrosis. This causes painful lumps in the anal area. Severe bleeding can occur causing iron deficiency anemia. Prevention of hemorrhoids or the piles. Drinking more fluid in routine practice. Eating more dietary fibers. Practicing better posture. Reducing bowel movement, strain and time. Avoid wearing tight underclothes. Washing the anus with the cool water and soap may reduce swelling and increase blood supply for quick healing. Exercises using squat toilet may help. Self-care at home. Hot sitz bath is very beneficial. Stool softener, but overuse of laxative should be avoided. Cold compresses may be bit helpful for temporary relief. Improving posture and muscle tone. Taking herbs and dietary supplements to strengthen the vein wall. Topical application of astringent and soothing agents like honey or aloe vera. Drinking chamomile tea several times in a day. Eating fiber-rich bulking agent like plantain to help create a soft stool and to lessen irritation of the existing hemorrhoids. Now the staging and treatment of the hemorrhoids. In the first stage, enlargement with the bleeding. Then we give the fiber supplement, cortisone suppository and sclerotherapy. In the second stage, protection with the spontaneous reduction, fiber supplementation and cortisone therapy. In third stage, protection require manual reduction. Then we give fiber supplementation, cortisone therapy, bending and operative hemorrhoidectomy as per modern aspect of view. And the fourth is irreducible protection, fiber supplementation, cortisone suppository and operative hemorrhoidectomy should be done. Additional therapy for bleeding hemorrhoids include rubber band ligation, sclerotherapy, excisional hemorrhoidectomy, and stapled hemorrhoidectomy, which is now very famous. Sensation begins at the dentate line, therefore bending or sclerizing can be performed without discomfort in the office. Rubber band ligations band are placed around the engorged tissue, causing ischemia and fibrosis. They aid in fixing the tissue proximally in the anal canal. Patient may complain of a dull ache for 24 hours following band application. During sclerotherapy, 1 to 2 ml of the sclerizing agent, usually sodium tetradecyl sulfate, is injected using a 25 gauge needle into the submucosa of the hemorrhoidal tissue. Care must be taken not to inject the anal canal circumferentially or stenosis may be occur. Suture and stapled hemorrhoidectomy are equally effective in the treatment of symptomatic third and fourth degree hemorrhoids. However, because the sutured hemorrhoidectomy involves the removal of the reductant tissue down to the anal verge, unpleasant and skin tags are removed as well. The stapled hemorrhoidectomy is associated with less discomfort. However, this procedure does not remove anal skin tag. No procedure on hemorrhoids should be done in patients who are immunocompromised or who have active proctitis. Furthermore, emergent hemorrhoidectomy for bleeding hemorrhoids is associated with a higher complication rate. Overall, when we move towards the Ayurveda, the treatment of Arsh is quite good as we treat the cause, give the fibrous diet, removes the constipation, and if the piles is outside, then we ligate it by Char Sutra or internal piles can also be ligated with Sclerotherapy. It is quite competent therapy which gives relief in. Thank you.